Tell us a little bit about these slides, these pictures of eyeballs.
Let's start with the mild. We were talking about early diabetic retinopathy. When you find it, you usually find one or two hemorrhages, a little bit of exudates. And the picture's a little small, but if you look on that mild diabetic retinopathy 10-month recovery, you can see there's the optic nerve, which is the light-colored thing, the dark-colored spot, which is the macula, and then up above the dark-colored spot, you see a red spot that's a hemorrhage. And in larger pictures, you can see a ring of lipid exudates around it. And we started them on this, and over a 10-month period, it completely went away. Follow-up pictures 2 or 3 years later shows it stayed gone. So the one on the top right, the severe diabetic retinopathy, that's 3-year follow-up. And the pictures almost don't do justice. You can't quite, but this person was down to kind of count fingers vision and 20 vision lost, already had lots of laser. You can see it burned out a lot of his retina. And gave it to him. I'll never forget that he came shuffling in with a walker and dark sunglasses and just non-functional. And 3 years afterwards, he came in and I actually didn't recognize him. And he was driving again. He got enough side vision back to the one eye that was 20/30. But you can see on the right image, you can see the white lines. And those are actually occluded retinal blood vessels those are gone forever. So that, but it doesn't have the little spotty hemorrhages. So we arrested the progression in the left eye. In the right eye, we had more to work with, and the larger enlargements of it, you can see lots of fleck hemorrhages that have gone away, and you can see the swelling in the retina has gone down. And he's now 20/30 and driving a car and just
Really?
Different person, yes. Then one of the big problems with diabetic retinopathy is you get occlusion of the veins and arteries. And this is a fellow that came in, was sent in with a hemorrhage. His optometrist saw a hemorrhage, sent him to me. And first thing I did is I worked him up for hypertension and diabetes and all that. And sure enough, he had undiagnosed hypertension and diabetes. So we treated that, put him on the ocufolin, and you could see over a 10-month period that recovered. Now, normally that's a 2 or 3 year period. And the average vision recovery after that kind of thing is about 20/50 or 20/60 vision, right on the borderline of being able to drive. In 10 months, he was 20/20. And lots of those. So this is out of the trial at Bascom Palmer at the University of Miami, where we took just early mild diabetic retinopathy, and we were just studying the blood flow and the tissue density of this. But we did check visual acuity at each visit, and you can see that they started out between 2025 and 2030, and their vision was getting into the 20/20 minus range at 4 and 6 months. And what I've noticed clinically in taking care of people is I still can see visible improvements out to 3 years. So my guess is that vision would have continued, but even at 6 months, we were seeing improved vision, which is kind of like the fellow in the upper right-hand corner.
Very helpful. So before we open up for questions, I remembered we promised we were going to give you a chance to talk about vitamin D. Want to make a comment about that?
Yeah, vitamin D regulates cell membrane interactions, and it's so important for so many things. As you know, Ford, y'all have talked about that. In my mind, when I think of vitamin D, deficiency in vitamin D increases harmful inflammation. So deficiency in vitamin D creates harmful inflammation, increases the risk and severity of diabetes, increases the risk and severity of diabetic retinopathy, increases the risk and severity of macular degeneration, increases the risk and severity of heart disease, and it reduces the absorption of L-methylfolate, which is key to fixing the homocysteine and the endothelium. And of course, it shortens lifespan. Other than that, vitamin D is not very important. Oh, and I didn't mention cancer and osteoporosis.
So other than that, not very important. Let's do one other quick slide for the group. We go down a bunch of bunny holes, but people often will come back and say, well, wait a minute, just give me the short version. What can I do to protect my eyes?
Number 1, don't smoke. If you smoke, stop now. Number 2, make sure your blood sugar averages below 100. Make sure your blood pressure is below 130/85. Whatever it takes to get to there, do that. Then exercise 150 minutes a week, at least. Then you can start looking at supplements. And supplements, I think, in order of importance are methyl B12, vitamin D3, L-methylfolate, pyridoxal 5-phosphate version of B6, riboflavin, and thiamine, vitamin B1. Higher doses of thiamine protects the vascular endothelium from surges of blood sugar. So it blocks damage from advanced glycation end products, AGEs. So those are the basic things. And when you start talking about all the vitamins, it's really hard to get a vitamin with all of them in the right format. And then you wonder, well, this vitamin was made in some third world country where the FDA can't inspect it. You don't know what the cleanliness and purity of it. So we created a product that was made in the US to high purity, have it as a medical food, so it's dispensed by a physician and monitored, and it's all the right stuff in all the right amounts. And as you can see on the studies, it gets results, and both from photographs and from the studies we are publishing out of Baskin Palmer. And this handout sheet, this is kind of a shortcut that we can make available to people if they like.
Thank you very much. Again, I think it goes back to that same theme of diabetes, prediabetes, and our arteries. So diabetes, prediabetes only damage tissues that are supplied by arteries, which means obviously the retina of the eyeball, the brain, nerves, kidneys, our erectile mechanisms, our legs, our hearts, you name it. Thank you again so much for what you've provided for us. Continue to get great feedback regarding the webinars, and here's why. You know, on the internet, when you hear a webinar, you expect for somebody to try to sell you something. We're not doing that. We're trying to tell you something. People are coming in with their labs from Quest, inflammation panel, OGTT, insulin survey response, and then they're finding out, do I have inflammation? Do I have insulin resistance? And where does that fit in terms of other folks? We're getting ready to start one for CINT as well. So again, people are really excited about finding out their own status. Looking forward to seeing you there. Thanks.